Hello, I'm Fiona from First Kind Limited and I am the Business Director for Wound Therapy. So I'm here today to talk to you about a novel device to promote wound healing in chronic leg ulcers. So the Gecko device is a new adjunctive therapy alongside standard of care. It can be used with lower limb bandaging, wrap systems and also hosiery kit. So it is an adjunctive therapy and should be used with full compression. So introducing the Gecko device, what it is it's a wristwatch size device. It's battery powered, disposable, and it's a neuromuscular electrostimulation device, CE marked and conforms to all EU standards. And you can see on the front of the device you've got a plus and minus. This basically turns the device on and off and also controls the stimulation levels. On the reverse of the device you've got the positive and negative electrodes and these are embedded within a hydrogel and this is what causes the stimulation. So how does it work? The Gecko, as I said, is a neuromuscular electrostimulation device and it's designed to increase blood flow in the veins of the leg. The Gecko device stimulates the common peroneal nerve once every second and activates the calf and foot muscle pumps. And this results in increased venous, arterial and microcirculatory blood flow. And that increase is equal to 60% of a patient walking without them having to move. So perfect for those patients that are immobile. So I'm going to talk you through the mechanism of action of the Gecko device. So you can see here the device in action. You've got the plus and minus and the flashing basically denotes that the device is working correctly. You apply the device at the fibula head and using the blue dotted line as a marker, and this gently stimulates the common peroneal nerve, and you can see that by the calf foot muscle pump working. This increases blood circulation equal to 60% of a patient walking, and you can see that nice blood flow. This is a speckle image and this is baseline, so this is without the Gecko activated, and this is 15 seconds into activation. And then this is 45 seconds into activation and you can see 1000% increase in the microcirculatory flux. So the Gecko device actually does reduce edema, and here you can see the mechanism of action working and you can see the muscle walls squeezing together. So when you consider the evidence on venous, arterial and microcirculatory flow and the reduction of edema, this really does accelerate the rate of healing. So the use of the Gecko device in wound management as an adjunctive therapy in hard to heal chronic leg ulcers has delivered a range of important clinical and economic benefits. So there is an improved rate of wound healing and 37% of our wounds healed in 12 weeks with the Gecko device, an improved rate of wound closure, hard to heal ulcers closed within 6 weeks. There was a reported reduction, patients reported a reduction in wound pain. Obviously there was a decrease in nursing visits and a reported reduction in edema. But we do have some new results to share with you, our recent RCT study. And you can see here the impact of a new intervention for venous leg ulcers, and it's a within patient controlled trial. So this is a randomised self-controlled trial comparing WMA and PAR for venous leg ulcers receiving 12 hours a day intermittent NMES of the common peroneal nerve as an adjuvant to compression compared to compression alone. There were 51 patients within the study. Both arms of the study spent 4 weeks on a run-in control phase receiving standard of care alone. Thereafter, the standard of care randomised cohort continued to receive standard of care alone for a further 4 weeks, and the NMES cohort received standard of care plus NMES for a further 4 weeks. And what the results they do tell us is adding NMES to standard of care over a 4-week period more than doubled the rate of healing compared to standard of care alone, and 42% of our patients healed completely with the Gecko device versus 27% with standard of care alone. What it also told us is that the Gecko device is very well tolerated by patients with an adherence rate of 94% within the trial. So a fantastic result. Our research evidence shows here the laser speckle contrast imaging, and you can see here that there's a wound, there's also a wound marker there, and there is no blood flow to the wound. When we turn on the Gecko device, you can see an activation causes a 225% increase in flux in the wound bed and a 67% increase in flux in the surrounding peri-wound area. And you can quite clearly see from this image that the blood flow is reaching right into the wound bed. When to use the Gecko device? So it's suitable as an adjunctive intervention for use in chronic hard-to-heal leg ulcers when they're not responding to standard of care. So you've tried everything you can, your patients have been in standard of care, but you're not seeing a positive trajectory of healing. Or there is a static rate of healing, no wound edge advance, there's no sign of revascularisation of the wound bed, or when there's risk of infection and you want to close that wound as quickly as possible. So thank you very much, and I would now like to hand over to Stuart Elliott, who's Tissue Viability Nurse in Isle of Wight. And Stuart's going to share with us some of his own experiences of using the Gecko device.
Hello, I'm Stuart Elliott, a Tissue Viability Nurse from the Isle of Wight. We've been trialling the Gecko device with First Kind. The first case study I have is Mr. J. He's a 78-year-old male. He has past medical history of peripheral arterial disease. He's had triple bypass, diabetes, hypertension, he's got peripheral neuropathy, and he had a stented popliteal artery in 2020. Now, this one's a little unusual because he isn't in standard of care, and mainly because he is particularly choosy about which dressings he will allow us to use. But he had ulceration over the right lower limb, over the Achilles tendon for over 4 years. It was a mixed etiology ulcer. It had a moderate amount of serous exudate, and the lower limb was also prone to small areas of superficial breakdown, which heal and break down when edema increases and decreases. The peri-wound skin was also prone to maceration and hyperhydration. Mr. J does elevate his leg for the majority of the day, but has very poor mobility and is only mobile around the home short distances to and from the toilet generally. So management-wise, the wound was debrided with larvae initially because it first presented as an area of necrosis. He was seen by the vascular team, who advised light 20 millimeters of mercury compression despite the monophasic pulses and poor ABPI. However, Mr. J did decline to wear this. He will only agree to wear a very limited selection of dressings. So we tried the Gecko initially for a month. When the results of this were quite interesting, Mr. J reported within 30 minutes of application that his whole limb felt warmer. In fact, he did say his leg had not felt this warm in several years. After 1 week, the skin on the lower limb was improved in condition, and he was very, very pleased about this. He felt that he was regaining his leg back, in his own words. He was happy with the improvements and actually requested to use the Gecko for longer. He was able to adjust the stimulation levels to suit his own comfort. Additionally, the level of exudate did reduce, the edema reduced considerably, and there has been a reduction in the wound size. I have to say that when I looked at the pictures side by side, I hadn't myself realised quite what a difference it had made, because when you see a wound like this on almost weekly basis, you sometimes miss the improvement. And equally, when I showed Mr. J these pictures, he was very, very impressed. And you can see from the beginning of December to the end of January, there's been quite a dramatic improvement in the condition of the wound. The second case study I have is Mr. A. He's a 69-year-old male. He owns and runs a guest house on the Isle of Wight, and he's a very busy man running the guest house. He's only mobile within his property, but he is motivated to do as much of the care as he can himself. He is a very tall chap. He's about 6'5", used to be a rugby player. He's had his leg ulceration for 20 years, and he actually self-managed it for 14 years. He has a high BMI of 41. On the assessment, his leg was very, very edematous, and he had serious exudate damaging the skin to the limb. In fact, it was leaking out from the limb and also damaging the soft furnishings at home. He has slough to the wound bed, and the wound swab showed multiple species, so antibiotics were commenced. Management-wise, when we first saw Mr. A, he was in a different compression system. We did swap him over to Ergo K2 for 2 weeks to reduce the edema. And then he was measured for Velcro adjustable wraps to enable Mr. A to apply himself and shower before dressing changes. He was very, very keen to be as involved as he could with the care of the wounds. The primary dressing was Ergo Clean AG with a super absorbent padding and stockinette and ready wrap applied over the top of this. And Mr. A applied his own emollient to the skin after showering. We discussed the gecko with him and he agreed to trial it initially for a month. The results of this were the improvement to the skin on the lower limb within 1 week. The level of edema did decrease, and actually the perfusion to the skin was much improved. So there was less dry skin as well around the whole of the lower limb, and with the maceration decreasing with the reduction in the edema. It was initially only applied to the ulcerated limb, but Mr. A actually requested himself to use on both limbs after 3 weeks because he saw the improvement made to his left limb. He reported it was very easy to apply, and he also reported he felt in control of the ulcer for the first time in many years. He felt like it had his power back, and he actually, in his own words, he had got his legs back. The ulcer to the left limb is now nearly healed as of February the 13th, and the whole area of ulceration just measured 5 centimetres by 3.5 centimetres. In fact, just before we came to do this video, I saw him the day before, and the ulceration is now very, very close to healing. So picture-wise, when you look at these pictures, then one of the 14th of November, you can see that the skin around the ulceration is very, very damaged. It was a very, very wet wound. I don't think the pictures do this complete justice it deserves, to be honest. One thing that you can't really see from the photos is the improvement that it's made in the actual overall size of the wound, and mainly down to my photography skills, I have to admit. So 4 weeks post gecko commencement, you can see that the skin of the whole of the lower limb is in much, much better condition, and a lot of this is due to the reduction in the level of edema and actually the better perfusion of the skin. The third case study I have is Mrs. R. She's a 46-year-old female. The injury actually first started as an insect bite, and she self-managed it for over 5 months with over-the-counter products, mainly Savalon, which obviously did not really have much of an effect. She was signed off of work due to the pain in the wound, and she worked in the retail sector. Past medical history, she actually didn't have any medical history at all. She was a relatively healthy lady for her age. On the assessment, it was a deep punched out ulcer. There was slough to the wound bed, and the pain level on presentation, which she reported as 9 out of 10, to the point where actually even trying to cleanse the wound with gauze and saline was too much for her to bear. ABPIs were well within normal limits. So management-wise, initially she was very, very reluctant. She declined to have compression, and the wound continued to deteriorate. Eventually she did agree to have a Doppler 2 weeks after the initial tissue viability review. We got the GP to review her analgesia, and we were able to get her in Actico 2-layer compression bandaging. After 2 weeks, we did try hosiery with Mrs. R, but she really found this difficult to apply and uncomfortable as well. So she actually requested to go back to bandaging, which we felt was a perfectly reasonable request. So dressing-wise, it was Ergo Start Plus with Convermax Super Absorbent and with Actico to secure and apply the 40mm of mercury of compression. I introduced her to the gecko, and she agreed to trial it, and actually went through some education with her. She was very, very keen to, trying to get involved with the management of the wound. Result-wise, well, we used the gecko for 4 weeks initially, and then unfortunately Mrs. R did go away, and we lost contact with her. She went to stay with family away out of our area. So after a further 1.5 weeks, she returned and requested further gecko application. For 2 weeks after this, the wound had actually healed, and the patient reported that after 1 week of gecko, her pain levels had actually reduced from 9 out of 10 to 3 out of 10. She did report it was very easy to apply, and actually adjusted the stimulation level to suit her own level of comfort. And she's actually gone back to work now. So that photograph-wise, the picture was beginning in December 2022, and by mid-February, that you can see that the wound area had completely gone. Now, one thing I would say is don't be fooled by the area of skin around that. This is down to her husband, who I did have a quiet chat with about shaving legs. He caused a lot of damage to her leg by shaving the hair off her legs when the compression had been removed. And so we've actually solved the problem there as well. Mrs. R was very, very happy with these results and with it being able to go back to work and getting her life back. These are just 3 of the case studies, but I have actually identified several more patients I would like to try the Gecko on, and working with my colleagues, we're looking at further patients to use the Gecko device on across our area.
So moving forward, we would like to invite you to join us with a Partner With Us programme. We of course welcome active exchange of fresh ideas, and we are committed to partnering with healthcare professionals to solve challenging medical problems. What that means for us is we can support you with data analysis, health economics, business case, and also communication. So we're really looking for in-service evaluations whereby we work with you and we will look at the results that you're achieving with Gecko, and we format this into a business case to show you what cost savings using Gecko could achieve for you and your trust. But we also want to work with you to help you achieve your own personal goals in terms of personal development. So that could be things like writing case studies, getting on the main stage and really talking about your achievements. So we'd really like for you to join us in supporting Gecko. Thank you very much.